All right, how are you? Chris, EHS Physical Therapy Chiropractic. Also, working here, partnered with Essential Motion Spine and Sport with Jake. Wanted to talk about kind of a follow-up to a post that I had just briefly put out last night, talking about the importance of positive and negative, mindsets, and how much people felt like it affected their life. And it wasn't supposed to be a trick question. Obviously, everybody was answering, well, yes, of course it affects. Okay, we know that. I mean, we've been conditioned and pretty much learned the importance of positive mindset,
Right,
training. But what are you doing to actually, work on it, to train on it? What have you been working on to recognize when, either negative thoughts or what I want to call learned helplessness has crept in or entered into life? And then we're going to draw some parallels between not only like life, say satisfaction, happiness, that kind of stuff, which is important for this, but also what we deal with most often, which would be mechanical pain, injury, that kind of stuff. How can that be? How can we use, mindset training, positivity, and recognizing those kind of things in the rehabilitation process? What we have learned, and this is not like me and Jake learning this. This is just
research.
what science says. That we are getting away from the old just biological model, and we're going into more of a biopsychosocial model, meaning the body and mind connection and how everything works together to improve not only your rehabilitation, but your interpretation of those things is very important. And so when we talk about the positive thoughts and positivity, say training, I was reading a book and they talked about this learned helplessness. And if you think about the way they explained it, it really made sense. You'll know someone that does this. They started with dogs, and they shocked the dog every time there was some kind of bell, just to try to work on that old classic conditioning type thing. Yeah. And so what happened was they eventually put the dog inside of a box, right, with a small wall in between. One side the shock was applied, the other side there was no shock applied. They theorized that the dog would clearly, like if I'm on that side, I get shocked, I'm going to move to the, and it was easy wall to hurdle. It wasn't a big challenge to get over to the other side. And what they found was that the dog did not move from the shock side over to the non-shocking side. And so they were like, well, this is just, the dogs are bad and this experiment is dumb. Someone then saw it though for what it really was and said, something's interesting here, what's going on? Practiced it with humans in a similar study setup where there was a loud noise, and they were told to try to turn the loud noise off with a series of like levers and buttons and try to figure it out. Well, of course, devious scientists, one side of the group, right, the experimental group, could not turn that sound off no matter what they did. There was another side of the group that was able to turn the sound off, so they were able to figure it out and turn the sound off. Then when they put those same people into another room, same situation, this time the hurdle was much easier. All they had to do was just slide a little lever over to stop the sound. The group that had failed, that had not been able to turn the sound off, didn't even try to turn the sound off, because they had learned that helplessness of, well, I'm in this stressful situation. It's repeated over and over again. I can't figure it out, so I just won't try at all. As opposed to the other group that was able to figure it out, quickly turn the sound off. Right. So I think we get into that with our pain and other things. So that, a definition that what I had found with learned helplessness is a state that occurs after a person has experienced a stressful situation repeatedly, over and over again, and they come to believe that they're unable to control or change the situation, so they don't even try, even when opportunities to change become available. And that's important. So what happens is, I think in our brains, we have the three different paths that we could take. When an adverse situation arises, and this happens not only in our, like with an injury could be an adverse situation.
Oh, absolutely, yeah.
So back pain happens, right? Even if you have the leg, the symptoms in the leg, the way you interpret that signal and that adverse situation, the belief that you internalize. Like the story you tell yourself can either be a negative one or a positive one. You can either say, yep, this is the worst thing ever. It's going to last forever. I'm never going to get through this. And then that then goes to a consequence of this learned helplessness where, well, even if an opportunity arises to improve this pain or fix this situation, people don't act on it. They don't take it. Where the opposite would be, not having that internal helplessness or telling yourself a different story, right? A positive belief of, okay, this is not long-term. It is what it is, right? I have to, it's not all-encompassing of my life. It's one part of my life. I have control over, how I interpret this situation, leads to a different consequence of finding the third pathway of, okay, I can get this thing fixed, and I'm going to use this as a small blip in the road. I'm going to improve the outcome by finding all the answers I can. So the three paths that we were talking about was, doing the same thing that you've been doing and accepting the same results.
Yeah.
Right?
That's the definition of insanity, right? Doing the same thing over and over again, expecting something different to happen.
Mm-hmm. So that's your status quo. You're not changing anything. My back hurts. I'm going to do the same things I've always done, and I'm going to expect the same results. Or craziness, like you said, craziness would be I'm going to expect a different result by not doing something. Or you could go the second way, which would be worse, down. I'm going to make decisions. I'm going to make action. I'm going to do actions that actually worsen my situation. Could be with medications, drugs, alcohol, whatever else, other situations that I'm choosing to go down this pathway instead. And when you have this learned helplessness, you don't see the third pathway, like we talked about, which would be the up pathway, which is finding things that, okay, this happened. Now what can I do? Maybe it is a blessing in the sense that, okay, I'm slowing down. I'm going to learn, how my body works a little better. I'm going to work on getting myself more fit. I'm going to, I never want to be in that position again, so I'm going to make sure that I never, and then on the backside of it, you come out even better than when you came in.
Absolutely.
What else? I'm learning I'm stalling here on my mind.
Yeah, so if we relate this to pain or low back pain, let's just tie it in here. So let's say we have an injury, right? And we've been dealing with this for a while, so we would call that like a chronic pain type thing. Something over 3 months is what we typically consider chronic pain, right? So that can be that stressful or that adverse event that happens in our lives.
That's the adversity for sure.
And we can go different routes with that, like you kind of laid out. So we can do nothing and just deal with it, and
hopefully it goes away.
Hope it goes away.
And then when it doesn't, then we're in that learned helplessness of like,
when it doesn't change,
this is never getting better. Exactly. This is my life from now on.
So then we go on the downhill, and then that can lead to fear of doing different movements. So we avoid whatever.
I like the fear avoidance. We didn't talk. Yeah.
We avoid walking. We avoid playing a sport that we used to play. Whatever it might be, which is unfortunate.
So making ourselves even weaker and even more depressed because now we don't have any of the things we love to do.
Yes. Yep. And then you can catastrophize from there, where you keep telling yourself, oh, I'm screwed. This is the worst pain I've ever had. I'm never going to get better. There's nothing I can do. And that just keeps feeding into the pain cycle, and actually plays a role in not only worsening your symptoms, but making them last longer. So the last route we can go is say, okay, I've got this problem, right? There's people out here like us that can help me get through this. I can reach out to and get some help, get the education I need, get the motivation I need to do something about it, and then get the push that some providers can give to you to say, hey, here's the routes we can go with this. You're not going to live like this forever. We have some options we can look at. We can, do rehab. We can start playing your sport again at a lower level, whatever it might be, just to start that stepping stone to get back to that goal that you have. And
sometimes it takes some time.
Yeah.
But when after it, when you're out of it later, months later, years later, it's the perception. When you're in the midst of it, in the micro, it's everything is so bad and it's never going to get any better. And then once you're past it, years later you look back, and then in the macro, the bigger picture, you look back and say, I guess that wasn't really that bad. At the time it was bad, but then later it wasn't really that bad. It didn't really last that long. I can relate it to, I guess, like, and this is a whole different, but like even when you have children and they're babies, right away it's difficult because they don't always sleep through the night. It's a lot of work, and so you feel like in the micro it's never like this is going to last forever. This is the hardest thing ever. But then later, years later, you look back. It almost even changes perception. Like I kind of miss that. It didn't last that long. It wasn't that bad. And that's just the story that you tell yourself. So there was another example in the book that I was reading on. Imagine if you were in a bank and there were 50 other individuals in the bank. The bank was robbed and you were shot in the arm. Would you perceive that, were you lucky that day or were you unlucky that day? And you can really tell from them, the people who, say they were unlucky are the ones that have that pessimistic view of, they could have shot anybody else. Like there was all these other things. I was just in the wrong place at the wrong time. That's a story or one perception of a made up event. This didn't even really happen. This is just your perception, the story you're telling yourself, or you could tell yourself a story of, no, I was lucky. Like it could have been worse.
Could have died.
I could have got shot in the head. I could in the chest.
Yeah.
Yep, there could have been little small children in there that could have died, and more people could have got shot. And you can see that the diverse or the differences, the dichotomous and how different that is in the stories you tell yourself of the same event, how you perceive that event. And that's not even a real event. That's just a study that someone, they would ask these people this question, and then you could tell right away who would be more likely to succeed in life and have better outcomes because of the way they perceived a made-up event. And that's all we're doing. That's all we're saying here too is separate yourself from the situation and think about what you're saying to yourself and the story you're saying to yourself. Do you even have any evidence, strong evidence to prove that what you're telling yourself is even true? Like, this is the worst ever. It's never going to get better. Do you even have any evidence to support that? And if I was, as Jake's friend, if I hear him saying that kind of stuff, would I say, Jake, that's nonsense. You're going to get through this. You're going to get better. Yeah. Like, I can hear you saying these, crazy things to yourself. But in our own mind, it's so much easier to
go the negative route.
And believe it, right? And really and truly believe it and internalize it. And that's what really blinds us to that third option of finding the positive in a situation, and not even the positive, finding a way out of making the situation, finding the benefit and the opportunities that are available, right? Even in our current situation of a global pandemic, there are certain people, certain businesses, certain entities that some have taken the route of, this is the worst thing ever. It's never going to get better. This is and they close down.
Yeah.
Yep. Some have pivoted and figured out, well, this is a short-term thing. It is what it is right now. We have to figure out ways to continue to adapt,
change.
And those companies have grown and made a lot more money for themselves and employed even more people and helped other people. That's mainly the ones. What else did you have on that part?
Just like you said, just reiterating the fact that if you're going through a situation, take that step back and look at it from a different perspective. Look at the routes you can go with it. Explore the options, and you don't have to have all the answers. You can reach out to friends. You can reach out to family. You can reach out to healthcure providers. Find a support group that will help push you.
That would even help even more. Yeah, then you wouldn't follow in your own little spiral of negativity and self-doubt and negative talk.
Having people to hold you accountable, and like you said, you wouldn't let me have negative thoughts. Have someone be there to help support you and get you through whatever you're going through. That's what you need to stay on that positive pathway, and that'll take you to success and give you a better outcome for whatever you're looking for and get you back to your goals. And that's the main point we're trying to get across, right?
Yeah, that's exactly what we just talked about in that. I didn't explain it ahead of time with the ABCD, method, but we talked about A, the adversity, B, the belief that you tell yourself, whether it's a positive belief or a negative belief, what story you're telling yourself. Depending on that story then leads to C, the consequence of how long you're going to be, in this problem. And then you move to D, which is the dispute part, right? So you want to dispute, like figure out, why is that a good belief or why is that a bad belief? And I think even just having the people around you already puts you past the learned helplessness part, because you can at least see the third option.
Yeah.
Like, I'm going to go get some help with this because I can see there's a third option. Where if you can't even see the third option, that there's a possible improvement, you're not going to reach out to people.
No.
Because it's just going to be either the same path or worse. So.
The light at the end of the tunnel.
Yep.
Stay
So
positive.
we wanted just to, we wanted to draw that parallel, obviously, along like just general life in general, and happiness and fulfillment and success. But we feel that there's a path or a line that you can draw directly that leads directly towards pain and injury, which is what we typically deal with the most.
Yep.
And knowing that the body and the mind are not separate. The body doesn't just do what it's told because of the brain. It's up and down, up and down.
Yep.
We used to think it's just always top down, that if you just had, without the head, without the brain, the body wouldn't, do anything. And it's not true. There's a very much bottom up situation where the body's sensors and nerves and systems tell the brain what chemicals, to release, and it's a very fluid system. And believing that, an injury is purely physical or purely biological is no longer true.
Yeah, that's not true.
Yeah. People have pain that have no biological, reason, no disruption of tissue whatsoever.
Yep.
And they still feel the pain. And people can have, bad, like we've talked about before, terrible looking scans and everything else. And so there's biological reason why you could have pain and they have no pain.
Yep.
So we can get into that in a different video, but that's enough for now. So thanks.
Thanks, everybody.